Good morning, everyone. This is Jeff Bellinger from Better Business Planning. Welcome you to the webinar today, which is going to cover the most commonly asked questions in healthcare reform. We're finding there's a lot of misinformation being communicated about healthcare reform, so we've asked Larry Grugin to provide his expertise this morning and provide everyone with the correct answers to any of the questions you may have. As we go through the presentation, Larry will be stopping to answer questions that you could type into the chat box that you should have available on the screen there. I'm going to just quickly tell you a little bit about Larry Grugin. He's an attorney practicing exclusively in the field of employee benefits. He has experience dealing with qualified plans, health and welfare, fringe benefits, and executive compensation areas. He has more than 35 years experience in employee benefit law, and he has extensive practice advising on all aspects of employee benefit law, including drafting and reviewing individually designed and prototype retirement plans, employee stock ownership plans, and performing due diligence on employee benefit issues for mergers, acquisitions, and outsourcing transactions, and advising on administration and design issues involving qualified retirement plans, including ESOPs and health and welfare plans. So Larry, this is the third time Larry's done a webinar for us recently, and this will be a good opportunity for anybody out there to ask any questions of Larry of any of the healthcare reform changes that are coming about. So I'm going to turn it over to Larry now to begin the presentation.
Jeff, thank you very much. If you look at your screen, and if you look to the right, you see a dashboard. If you look down the bottom of the dashboard, there's a question tab. Why don't you put your questions there? And what I'm going to do as I go through the presentation, I'll stop periodically to answer any questions that are sitting there. You can type them in. It's relatively easy. Then I'll do it during the presentation, and at the end, for those questions I have not answered, I'll go through the remainder of the questions. Now, the problem with this area is it's very convoluted and confusing, and many people are asking me tons of questions, and they're getting rather confused. So what I've done in this presentation, I've collected 21 common questions that I've been getting from my clients, and I get probably 40 to 60 questions a day on this. And I've cataloged them and put them in this presentation. So let's look at this and see what they are. Which employers are subject to the employer mandate in 2014? Remember, only large employers are subject to the employer mandate. There's a lot of confusion about this. And I have other questions in a few minutes how to determine whether you're a large employer. But the determination of whether you're large is determined for calendar year 2013. We look at 2013 to determine whether you're a large employer. Now, there's a special transitional rule that says that if you, instead of using the whole calendar year 2013, you can use any 6-month period in 2013 to determine whether you're large. Now, in this determination, what we do is we determine for each month the number of full-time employees and add to that figure part-time hours. So I'll be covering that in a few minutes. Now, there's a lot of confusion about this issue right here. If my employer is a large employer and sponsors a health plan with a non-calendar year plan year, when does it have to comply with the employer mandate? Now, suppose you or your client, or your employer, you have a renewal date that's other than 1/1/2014. Basically, you have to jump through several hoops in order to determine when the employer mandate applies. Because under the law, it says that the employer mandate applies as of 1/1/2014. But if your employer, if your client sponsors a non-calendar year plan, then you can use that renewal date in 2014. So what do you have to do? How do you comply? Well, first of all, as of the renewal date in 2014, you have to offer all eligible full-time employees coverage that's affordable minimal essential coverage. And I'll be getting that in a few minutes. And secondly, you have to meet one of two rules. One, as of December 27th, 2012, did you offer all employees coverage? And all employees are both full-time and part-time. So the first rule, did you offer 1/3? The second rule is, or did you cover at least 1/4 of your employees as of December 27, 2012? So it's either or. You have to meet either or requirement in order to use your non-calendar year plan year. Now, a second clarification, there's no official guidance on this yet, but what's interesting is suppose your employer puts all their benefits in a wrap document, and the wrap document has a plan year as a calendar year. Which year do you use in that situation? And unofficially, the DOL said that that's basically done on the wrap plan year. So if your renewal date is non-calendar year, but your wrap document has a calendar year plan, then it's going to be based on the plan year of the wrap plan, because the way the regulations read, it's based on a plan year. Now, for many of you, especially if you're under 100, you haven't really dealt with this because you don't file 5500s. Now, you have to look and see in that situation, if you do file 5500s for your medical plan, what is your plan year for that purpose? Now, how does an employer determine if it's a large employer for employer mandate purposes? As I indicated before, it's based on a calendar year 2013 or a 6-month period in 2013. Which employees are considered all employees' hours are counted for this determination. Basically what we do, we take the months that you're using, we total the number of full-time employees, and we add to that for each month the total number of part-time employees. And then for each month, we divide those part-time hours by 120. That will give you what's called full-time equivalent employees, and those employees are then added for each month to the number of full-timers. So you could have a situation where you could have 20 full-time employees and 200 part-time employees, and that employer could be a large employer for this purpose. Now, what's confusing a lot of people is that to determine how many part-timers are turned into full-time employees, the divisor is 120. But in employees that you have to offer coverage to, the full-timers have to work 130 hours a month, and that's what's confusing a lot of people. Now, there's a special rule in the regulations that say that if you are generally employ 20 or 30 employees, but for 4 months out of the year, you employ seasonal employees, and because of the number of seasonal employees that you employ for 4 months, it puts you over being a large employer. For this purpose, we can ignore the seasonal employees who work 120 or 4 months out of the year. Now, again, what is the time period in which this determination is made? The statute says it's made over the calendar year. So for 2014, you would use the calendar year 2013. But as I said a couple of times already, the IRS has indicated that you can use any 6-month period during 2013 to make this determination. And what many employers are picking a 6-month period, especially if you have seasonal employees, where there's not that many people working, and that could buy you another year. So whatever period you use, 6-month or 12-month, you determine the full-timers and part-timers for each month, you total them up, and then you divide it by the period that you're using, either 12 months or 6 months. And that what's resulting is 50 or more, then you're considered to be a large employer. Now, if you are a large employer, then your responsibility is to offer full-time employees coverage. This is the only time in healthcare reform that part-timers are considered, and their hours are only considered to determine whether the employer is large or small. In determining whether an employer is a large employer, for the employer mandate purposes, when do we have to consider other businesses owned by the employer in the total? What the IRS has said is that to determine whether you're a large employer is done on a control group basis. So if your employer owns other businesses and have a controlling interest in those businesses, then for the purpose of whether you're a large employer, you are considered to be as one employer. So if you're working in a business that has 25 employees, but you know that your employer owns other businesses, those employees of other businesses would have to be totaled together to determine whether they're a large employer. This is the same determination that is used for 401k plans and other purposes under the tax law. So your accountant or your attorney should know whether your employer owns other businesses. Let's stop here and see what questions we have already. Again, I'm looking at the question tab. When we shop for a plan, would either the HRA or HSA component be integrated with and offered by HBHP, for example? Would XYZ insurance company offer, we had a standalone HRA in the past and will be dissolved, and and we might offer one that's associated with the qualified plan, but we don't understand the meaning of that term. What the IRS has said and the DOL has said for 2014, an advice called a freestanding HRA, especially for large employers, are no longer going to be required. Now, what does it mean to have an HSA or an HRA integrated, which means that those plans will pay any expenses not paid by the group health plan. And that's the easiest HRA, for example, to have, because basically in running those plans, the only thing that the employer has to present to you to be reimbursed is what we call an EOB, evidence of of expense, showing that the health plan did not reimburse that plan, and that's a very easy plan to administer. We have many long-term leased employees, some working for us for decades. The leasing company issues W-2s, not us, but we control their work. Would they be considered the employer of these individuals, or would they push us into being a large employer? What the IRS has said is that for leased employees, they're considered to be employees of the leasing organizations. For any temp employees that are employed by the temp agency, the IRS said that those are the employees of the temp agency. The situation is different with the PEO. In that situation, the IRS has not issued any guidance yet, so stay tuned, because for those employees, it's a unique situation because those employees are considered to be employees of both the PEO and the employer. There's a co-employer relationship in that situation. So if you use a PEO, stay tuned, because we don't know exactly which way the IRS is going to go in regard to this. Will this presentation be available for future listening? Absolutely. It's being recorded as we speak. So again, this discussion and the questions will all be if a municipality with 200 employees has a 7/1 to 6/30 plan year, but does not file a 5500, and they covered more than 1/3 of their employees as of 12/27/2012, are they subject to the employer mandate as of January or July? They would be subject to the mandate as of July. That would be the plan year, because municipalities don't have to file 5500s. And again, that's the same situation if you have under 100 employees. What do we need to do for an employer mandate purposes if we are not a large employer? I'll be covering that in a few minutes, but if you are not a large employer, there are there's going to be requirements of what you issue your employees. So you're not required to offer insurance, but I have 4 or 5 questions during the presentation that talk about being a small employer. So be patient, and I'll be getting that in a few minutes. We are a social enterprise owned by two not-for-profit organizations. Well, we fall under them for employer size purposes. For not-for-profits, it's based on who controls you, not ownership, of course. So therefore, there are IRS guidelines in regard to not-for-profits, and it's based on who controls your organization. Okay, that's the end of the questions, and please feel free to input any questions in the future. I'll keep on going through these questions. Let's go on to question 5. Question 5 is, does the employer have to offer health coverage to the employee's children or spouse? And if we do, does the employer have to pay for it? Now, if you are a large employer, you're under an obligation to offer your employees affordable essential coverage. Now, the law says that you have to offer coverage to 95% of your employees and their dependents. At 95%, so if you are at 93%, there's a $2,000 penalty that you may be assessed. So you have to make sure that you don't want to, and where you could run into problems in regard to this, if you determine, for example, an employee is part-time and it's really full-time and you offer them coverage. So again, to avoid the $2,000 penalty, what you have to do, you have to offer coverage to 95% of your full-time employees and their dependents. And a full-time employee is defined as anybody working 30 hours or more. Now, there's another requirement under the law that the coverage that you offer to the employee must be affordable minimum essential coverage. What does that mean? For single coverage, the employee cannot pay more than 9.5% of their wages. But you do have to offer coverage to the employee's children. But again, as an employer, you don't have to pay for it. You just have to offer to the children. But again, you don't have to offer coverage to the spouse. Let me repeat that. Starting in 2014, you have an obligation to offer your employees affordable coverage. And that affordability rule is 9.5% of single coverage. I'm sorry, 9.5% of their wages, excuse me. But that only applies to single coverage. You have to offer coverage to the employee's children, but not the spouse. So again, as an employer, you don't have to pay for the dependent children coverage. Now, this is the rule I just talked about. In determining whether health coverage is affordable, any premium charged to an employee cannot exceed 9.5% of the employee's household income. How is the employer going to determine that figure? That's how the statute reads. But the IRS created 3 safe harbors, and you should know about this. You can either use the employee's W-2 wages for the previous year. rate of pay times 130 hours per month, or the federal poverty line, which is, I think, 11.6, 9.5% of that. Now, in making that determination, I've gotten a lot of questions in regard to this requirement. And the first question I get, well, does that mean that I could charge every employee a different amount? And the answer is yes, depending on their wages. So each employee could pay, as their income goes up, could pay a higher amount. Absolutely. The second question, as an employer, could I just say, I'll determine 9.5% of the employee making the lowest salary and base it off of that? Yes, you can do that too. That's very generous, but that's one way of doing it. The third way of saying it, and some employers are contemplating this, by saying to the employees, okay, we're going to pay the single coverage, 100% of it, so for everyone, the coverage is going to be affordable. Now remember, your obligation in 2014 is to provide affordable minimal essential coverage. Minimal essential coverage means that the plan pays 60% of the expenses under the plan. Most employer coverages right now are way, way above that. They're in the range of 70 to 80%. So what you may want to think about in 2014 is finding a cheaper plan and basing your contributions off of that, and maybe offering your employees a second or third plan they can buy up to. But your obligation as an employer, as a large employer, is to provide them with that cheaper plan, and that 9.5% figure is based on the premium for the cheaper plan, but it's 9.5 of the employee's wages. And again, what type of health coverage is the affordability test based on? It's based on single coverage only on the minimum essential coverage, which is 60%. And again, this is something that is much less coverage than what you're used to as an employer, but that's going to be your obligation as a large employer in 2014. Now, question 8 talks about our plan sponsors a wellness program. If an employee satisfies certain wellness standards, his or her premium is reduced. For the affordability test, what premium is used? And again, under current law, that reduction can be as high as 20%, and in 2014 it can be as high as 30%. And for smoking cessation program, the reduction can be as high as 50%. So the big $64,000 question in the past is, well, in determining affordability, do we use the premium before or after the reduction? Which one do we use? And in the beginning of May, the HHS came up with an answer. And they said that all wellness incentives will be ignored except for smoking cessation. If you sponsor a smoking cessation program for the purpose of the affordability test, the premium will be determined as if everyone is a non-smoker. So the reduced premium will be considered for the affordability test. Any other wellness incentive will be ignored. So please remember that. Let me repeat that. For the wellness incentives, if you, as an employer, sponsor a wellness program, the only incentive that will be considered for the affordability test is the smoking cessation. And for this purpose, everyone will be treated as if they did comply with the smoking cessation incentive. This is a very common question I'm getting. This is question 9. If my employer is determined to be a large employer, does it have to offer health coverage to part-time employees? And the answer is no. So if you employ anyone who works less than 30 hours a week, You have no obligation to offer any coverage to these individuals. You can if you want, but you don't have to. And the challenge for some of employers is to determine which of the employees are part-time and which are full-time. And what the IRS has created is a very elaborate and complicated safe harbors that you can jump through to determine which of your part-timers are really full-time. And you can use a determination period of 3 to 12 months to determine if any of your part-timers are full-time, that where you have to offer them coverage. Now, the way to get around it is to say to all of your part-time employees, at no time will you ever work more than 28 hours a week. If you do that, then you're fine, then you know I have to offer them coverage. But if you're part-time or seasonal employees, hours will vary depending on the project or time of the year. Please, to protect yourself and your employer, check hours. And what you can use, if you, for example, use a 12-month measurement period, that part-time employee would have to work 1,560 hours to be full-time and to be offered coverage. If a part-time or seasonal employee works less than that, then you, as an employer, are under no obligation to offer them coverage. Please remember that. But you have to demonstrate to the IRS that that part-timer is really part-time, and they're not full-time. Because if they're full-time and they go on the exchange and they get a credit and subsidy, then you, Mr. Employer, will be penalized. So you have to demonstrate the fact that why you didn't offer coverage to your part-time employees. Question 10. In any year, do you have to offer coverage to a part-timer even if their hours go below 30 hours per week? In this situation, when I'm talking about, suppose you have a part-timer, and in a year, you measure their hours, and they do work 1,560 hours. So the 12 months after that, you have to offer them coverage. And the IRS says that if that part-timer is determined to be full-time for that 12-month period, that's called a stability period, you have to continue to offer them coverage even if their hours go below 30. So during this 12-month period, it's called the stability period. As long as they're working an hour a week for you, you have to continue to offer them coverage and be covered until the end of what's called the stability period, and that period can be as long as 12 months. Now, if we hire an individual as part-time, and then his or her status changes to full-time, do we have to offer them coverage? When do we have to offer him or her coverage? And the answer is the IRS and regulations indicated that you can wait to the earlier of the end of the measurement period, or 4 months after their status changes. So please remember that. So if you have anybody that you hire as part-time, they work for you a few months, and you say to them, we'd like to hire you full-time. And the next question is, well, when do I have to offer them coverage? And again, it's the earlier of the end of the measurement period. And again, for any new full-timer, they get their own initial measurement stability period, the earlier of the end of the measurement period, or 4 months earlier of 4 months that their status changes. And this is another tricky situation. It's in question 12. We hire an individual as full-time, and then later he or she begins working full-time. When do we drop coverage and redetermine his or her eligibility for health coverage? So you hire someone as full-time, they wait 3 months, they get covered. Because remember, if you hire anyone as full-time in 2014, the longest period of time they can wait to be covered is 3 months. So let's say 5 months into their employment, they come to you, or you determine that there's not enough hours for them, and you say, I'm sorry, but we can no longer offer you full-time employment, but we can offer you part-time employment under 30 hours. Well, again, their coverage would either end the month in which their hours are reduced, or the end of the month, and then their coverage would be dropped, and they would be you would have to offer them COBRA. Well, the next question is, well, when you have to offer them coverage again? Well, at that point, what you would have to do is you have to start measuring their hours during a measurement period, and at the end of the measurement period, if their hours are on average 30 or more, then you would have to then provide them coverage again, or if they're not, you don't. So again, if anybody starts with you full-time and then goes to part-time, you just have to remember that, oh, I have to start measuring their hours to see when, any time in the future, they're full-time, and if they start working full-time again on average, then you have to, again, offer them coverage. The question is, regarding question 8, has the IRS issued guidance on how the employer can police smokers? And the answer is yes. It has to be through a smoking cessation program. And you can have individuals recertify as whether or not smoking. You can actually have them take a test, go through through some hoops to redetermine. So again, in this situation, any smoking cessation program that you provide rewards or penalties has to be through a wellness program under HIPAA. And under those programs, you can require individuals to either sign a statement or take a test to determine whether they are smokers or non-smokers. Let's look at some questions. Let's stop for a second and let's see if we have some additional questions. Let me just check for a second. I'm looking through all my questions. It doesn't look like we have any additional questions. Oh, another question, I'm sorry. Is the 9.5% of employees' wages, or is it household income? For your purposes as an employer, even though the statute says household income, to determine affordability for your employees, it's based on one of 3 safe harbors. It can be based on box 1 of W-2 that says previous year W-2. The current wages of an individual times 130 hours per month. Or as I said before, the federal poverty line safe harbor, which is based on that figure for the year, which is currently at like 11.6. So if an employer determines they are not subject to the employer mandate until 3/1/2014 because their plan year, or they have under 100 employees and not have to file at 5,500, do they have to offer coverage to employees working 30 hours or more until March 1st? Correct, yes. Again, if your renewal date and if you meet the requirements of the safe harbor, the special transitional rule, then you don't have to comply with the employer mandate requirements if you're a large employer until March 1st, in your example, of 2014. Now remember, Starting in 2014, either 1/1/2014 or your renewal date, if you qualify, what your obligation is in 2014 is to offer all full-time employees coverage. And a full-time employee now is defined as 30 hours or more. So if your insurance contracts or if your plan says a full-timer is 35 hours, starting in 2014, those rules will have to be changed, and more employees will have to be offered coverage. If our company employees belong to a union, who's under the obligation in that situation? Well, if your employees belong to a union, you still have to determine, as an employer, for anybody who works for you, whether the union plan is affordable minimal essential coverage. So just because your employees are unionized doesn't mean you're off the hook. And in the guidance that came out in December of 2012, the IRS indicated what the responsibilities are for an employer whose employees are unionized. You have to check and see whether the union plan is affordable minimal essential coverage. So you can't say, well, since my employees are unionized, I'm off the hook. No, you have to check and see if the union plan is affordable minimal essential coverage. What is the measurement period for a new employee? The measurement period for a new employee is any 3 to 12-month period starting on their hire date. Now, if you use, there's two different safe harbors to determine whether full-timers are, whether part-timers are full-time. One is for ongoing employees, where you, the employer, picks the 3 to 12-month period. For new employees, each new employee has their own initial measurement and stability periods, and it starts on their hire date. Now, what the IRS has said, that if you pick a 12-month measurement period for any ongoing employee, then the same period has to apply to your new employees. So every new employee gets their own initial 12-month measurement and stability periods. After they work for you for that period of time, then they're tested along with the rest of the ongoing employees. I asked an additional question, the one about the employer with a 3/01/2014 renewal date. For 2014, we'll be determining affordability based on W-2 wages. For which year, though, we wouldn't have the W-2s until 2014. You would base it on the W-2 wages for 2013. If we offer affordable coverage and a large number of employees decline to participate, are we in still compliance with healthcare reform? The answer is yes. The most important form in 2014 is the waiver form. Your responsibility as an employer is to offer coverage to employees. They don't have to take it if they don't want to. So you have to offer coverage to the employee and their dependents. As long as the coverage is affordable and they waive it, there's no penalties. Okay, let's go on. Those are the last of the questions. Let's go on to question 13. We offer affordable minimal essential coverage to the employees and their dependent children, and the employee goes on the exchange with his or her family. Will the employee be eligible for credits and subsidies on the exchange? And the answer is no. The IRS has indicated this. So as long as you offer affordable coverage to the employee, offer coverage to the dependents, and even if the spouse doesn't work and they go on the exchange, they have to pay full freight. They can go on the exchange, of course, but they won't receive any credits and subsidies. Now, if my employer offers health coverage to 95% of the employees and their dependents, will it still be liable for any penalties? Now, suppose you cover 95% of your eligible full-time employees. and you miss 5%. What happens then? Well, because you offered it to 95% of your full-time employees, you will not be subject to the $2,000 penalty. But you will be subject to the $3,000 penalty if any of those 5% of your employees goes on the exchange and gets a credit or subsidy. So, and that $3,000 penalty only applies if they go on the exchange and get a credit or subsidy. Now, if my employer has various companies that do not offer coverage, will my entire employer be penalized? And what the IRS has said in December, the application of the employer mandate penalty applies separately to each member of a control group. Let's say we have a company with 3 members of a control group, and let's make it easy. Let's say each one has 30 employees. 30, 30, and 30, which is 90. It's a large employer. Now, in 2014, 2 of the employers decide to offer coverage, the third one does not. And that third employer has 30 employees. To determine what the penalty is for that last employer, what the IRS has said is that, remember, the $2,000 penalty has a minus 30 employee reduction. And what the IRS said, well, that 30 employee reduction is it applies to the whole entire control group. And since my the employer that's not offering coverage is 1/3 of the total number of employees, they only get 1/3 of that 30 reduction. So in my example, it's 30 minus 10 or 20. That employer not offering coverage would be subject to a 20 times 2,000 or a penalty of $40,000. So again, the most important thing to remember is the penalty is, again, not applied to the entire population of a control group. Now, if an employer is not a large employer, does it have to offer any coverage to the employees? And the answer is no. You have no obligation to offer any coverage to your employees. But please remember that if you don't offer affordable coverage to your full-time employees and they go on the exchange, you're not going to be penalized. But what's going to happen is going to make your plan unaffordable. It's going to make your plan unattractive because that employee can then get a credit and subsidy. So if you don't provide affordable coverage to your employees, that could affect in the future your participation. So please remember that even though you have no obligation to provide coverage, by not providing affordable coverage to your employees, it could affect your participation in the future. If a small employer offers affordable minimum coverage to its employees and its dependents, can they go on the exchange and receive credits and subsidies? And as I just said, no. And that may, again, help you continue your health plan because then you're not competing against the exchange. In 2014, what coverage must a small employer offer if the plan is non-grandfathered? And will there be any limits on deductibles and out-of-pocket amounts? If your plan is non-grandfathered, starting in 2014, every small plan and then every individual plan will be community rated, which means that the only factors they will consider in determining your premium is the coverage offered, the age, the area, and whether the individual is a smoker or non-smoker. No other factors will be considered, which means your younger workers will pay more and your older workers will pay less. Now, are there any limits on deductibles and out-of-pockets? Yes. There's a limit of $2,000 for single, $4,000 for family. And the out-of-pocket limits, which means deductibles, copays, coinsurance, will be $6,350 for single coverage and $12,700 for family coverage. The deductible limit of $2,000, $4,000 only applies to small employers which are non-grandfathered. It doesn't apply to large employers. But the out-of-pocket limits I just mentioned, $6,350 and $12,700, also applies to large employers. Now, in regard to question 13, if there is no employer contribution for a spouse and or children, wouldn't the spouse or children still qualify for a subsidy even though the employer is then penalized? And the IRS said no. Question 19. What coverage must a large employer offer its health plan if it's non-grandfathered? Again, what you have to offer is affordable minimal essential coverage. Are there any limitations on deductibles and out-of-pockets? No limits on deductibles, but again, there's an out-of-pocket limit of $6,350 for single coverage, $12,007 for family coverage. Now, one thing I forgot to mention in question 18 is, is the fact that to get to that $2,000, $4,000 deductible for small employers, you cannot use an HSA or an HRA. Can HRAs be used in 2014? And the answer is yes. Can freestanding HRAs be used? And the answer is no, especially in the large plan market. Are there any limitations on small employers in the use of HRAs? And the IRS has indicated that an HRA or an HSA cannot be used to get down to that $2,000, $4,000 deductible. It must be pure insurance. And lastly, what fees will be imposed on health plans under healthcare reform? There's going to be two fees that are going to be imposed in 2014. This is both large and small employers. First of all, there's going to be something called a PCOR fee, which first of all in 2013 it's going to be a buck a head, buck every covered head. And then it will go up to $2 a covered head. So a family of 4 at first is going to be $4. Then it's going to go up to $8 a head. Now, if you are insured, the insurance company will pay the fee, and it's reported on Form 720, and it's due the following July 31st of any year. If you're self-insured, then you as an employer have to pay for it. Now, what some insurance companies are doing, they're billing their clients for it as a separate item. That's called a PCOR fee, which funds a research institute. The second fee is called a reinsurance fee, and it's going to be $63 a head. It applies to both insured and self-insured plans. What's going to happen is you're going to get an inquiry from HHS. We have to give them particular information. Once you give them information, then they will determine how much to bill you. But all indications are it's going to be for both insured and self-insured plans, $63 per covered head, and probably that's going to be in 2014. All right. There's my contact information. Now let's go through some questions. That's my contact information. And let's go and see if there's any additional questions. Follow up on W-2 wages. You mentioned that we've applied 2013 wages to determine affordability using the W-2 issued in 2013. Yes. How would it affect our participation in the future if a small employer, we do not offer affordable coverage? And again, as a small employer, what's going to happen is that if you don't offer affordable coverage, your employees can then go on the exchange and they're free to get any credits and subsidies. And you say to yourself, well, what are these credits and subsidies? First of all, there's a premium credit. And depending on what their income is, they can pay 2 to 4 to 6 to 8 to 9.5% of their wages as a premium under the exchange for coverage. Now, these premium credits are only available if you, as an employer, don't offer affordable coverage. The other assistance is going to be assistance with co-pays, co-insurance, and deductibles. Depending on the income, that reduction of that figure could be anywhere from 2/3 to 1/2 to 1/3, depending on the income. All these are based on how much your employees are making as a household. So if you employ a lot of lower paid people, again, what could happen in the future is that if you don't offer affordable coverage, again, you may want to encourage employees to go on the exchange because the government will pay most of the cost of providing health coverage. I did a study for one of my clients. Somebody was making $22,000 to $24,000. The employee, because if it's a family of 4, were eligible to only pay 2% of their income for the premium. They picked up a $12,000 coverage per premium. The total cost for the employer is $461 a year. So again, depending on what you want to do if you're a small employer. Now, my only warning on that is I don't think the exchanges are going to be that great at first. The first open enrollment is going to be October 2013, so employees are going to start enrolling after that. Let's go with some more questions. We wouldn't have 2013 W-2 wages until sometime in January 2014. That's true, but you could have preliminary numbers to base it on. Question 21, are the fees per month or annual? It's an annual fee. What is a freestanding HRA? Freestanding HRA is an HRA that is not integrated with a insured health plan. Some smaller employers are saying to the employees, I'm going to give you $5,000 a year, and I will either reimburse premiums or expenses, but that's how much I can afford. And especially if a large employer starting in 2014, the IRS said, I'm sorry, but HRAs have to be integrated with an insured health plan, which means that the HRA will pay any expense up to what you determine that the health plan doesn't pay. So please remember that. Please review the PCOR fee. The first year the PCOR fee applies to, it applies to plan years beginning after September 30, 2012. And if your plan year ended before January 2013, the first PCOR fee is $1 ahead, and the first fee is due by July 31, 2013. Now, if you're insured, the insurance company will pay the fee of $1 per head, as per year. The next year, 2013, the PCOR fee will go up to $2 a head. Now, if you're self-insured, you'll have to pay the fee. Now, if your plan year ends sometime in 2013, the first PCOR fee is not due to 2014. All right? So please remember that. How do we get a copy of this program? I sent an email to everyone before the presentation. You should have gotten an email, and there was a link to it. If you didn't get it, just email me, and I'm more than glad to send you a copy of the presentation. How does it differ from an HSA? Remember, an HRA is just employer money, where a HSA can be both employer and employee money, and because it's employer money under an HRA, the employer controls when it's being spent, how it's spent, and how long it's available. With an HSA, once you put the money into an HSA, it's the employee's money, and they can spend it any way they want. The employer has no control. While under an HRA, the employer has total control over the money because it's employer money. We currently pay 85% of the premium for employees who work 37.5 hours. Well, we need to pay the same percentage for those work 30. Yes, and again, it's the employees cannot pay more than 9.5% of the wages, so you have to determine exactly how much that is depending on their income. We offer a HMO, a PPO, and an HSA. We have been banking on our HSA as being affordable for the lowest paid employee. The HSA has a $3,000 deductible, but we, the employer, pay up to 50% of that. We are a small employer. You mentioned that we cannot use an HSA for the deductible limit. Will this not be considered affordable? And again, HSAs and HRAs can be used to determine affordability and minimum value. But what the IRS said, if your plan is non-grandfathered, it cannot be used to satisfy the $2,000 and $4,000 deductible. So please remember that. Let's go on. Okay. We have a standalone HRA. Do we have to still have to pay the P-Corp fee due the end of July? Yes, you have to pay it. There are some exceptions for HRAs, so talk to your broker about that. If a small employer if a small company has an average salary of $60,000, will the employee still be able to get a credit or subsidy if they go on the exchange? Yeah. And the credit and subsidy won't be that high because the credits and subsidies go to up to 400% of the poverty level, and for a family of, I think, 4, that's up to $93,000. So the most the individual can pay on the exchange, if you don't offer insurance, is 9.5% of their household income. Do you foresee many employers making this easy on themselves and charging employees just less than the 9.5% of their W-2 wages? If they do this, they will not risk the penalty. And again, there's 3 approaches you can use. Every employer is different. So to make it easier on yourself, there's not just one way of doing it. Bear with me a second as I go through the questions. If our current deductible is $3,500 and our HRA is a $1,750 for that purpose, would that be allowed still? And again, if your plan is non-grandfathered, what the law says, if you're a small employer, the maximum deductible is $2,000, $4,000. If your plan is non-grandfathered, but only applies to small employers. Do executive reimbursement plans fall under the freestanding HRAs? And yes, it would. Well, Jeff, do you have any other comments or questions? I've answered all the questions.
No, thanks a lot, Larry. You answered quite a few questions, so hopefully everybody did get them in, and you provided your email address, and if anybody does have any other questions, they can certainly email me as well at Better Business Planning, and we could get them an answer.
Well, everyone, thank you very much. Hopefully you found this not exceedingly confusing. I know I got some people indicating they're confused. This is a very difficult area. As I indicated before, this webinar has been recorded. Please, if you want a copy of the recording, see Jeff at Better Business Planning, and he can hook you up with a copy of the recording. So again, thank you very much, and hopefully you found this useful. Bye-bye.
Thanks, Larry.